Now, here's the thing. What can your face tell you about your health? Apparently an awful lot more than you think. It's an interesting one, Amir. Tell me, what are the key areas to look out for that your face could be telling you what's going on?
Yeah, morning, Lorraine. The face can tell you a lot about your health, actually. So we'll start with the eyes. If you've noticed new white or yellowish lumps around your eyelid, particularly kind of up here around that bony part there, that could be a sign of raised cholesterol. It's called xanthelasma. And if you've got a family history of heart disease or stroke or type 2 diabetes, get your cholesterol checked. Or if you've noticed that your eyelids are droopy, either both or one of them, that could be harmless. It could be normal for you. But if it's new and persistent, get it checked, because it could be a problem with the brain, the nerve, or the muscles of the eyes. Now, moving down, we're going to look at the chin area. So ladies, or those assigned female at birth, if you've got excess hair around your chin or neck or jaw area, then that could be something called hirsutism. And it could be a sign of polycystic ovarian syndrome. That's where you get a hormonal imbalance and raised testosterone levels, which can cause excess hair around there, particularly if you've had trouble getting pregnant or irregular periods. Go and get checked for polycystic ovarian syndrome. Next, we've got the cheeks. If you get lots of rashes on your face, but if you've got a lumpy red rash, we call it a butterfly rash. It goes across your nose onto your cheek area there in the shape of a butterfly. That could be a sign of a condition called lupus. That's an autoimmune condition where your own immune system attacks healthy tissue. It can cause extreme tiredness, joint pain. It's worth getting that looked at. And then finally, if you're getting recurrent cold sores around the lips and nose area, that could be a sign of your immune system saying, actually, too much is going on here, you're run down, we need to sort this out. So exercise, sleep, good nutrition, lots of hydration, and relaxation exercises is what you need.
How fascinating. Thank you, Amir, for now. Hilary, there's a thing as well called HRT face. What is that? As someone who takes HRT,
Sure. Well, as you know, HRT is licensed to be prescribed for menopausal symptoms, but it has a nice little side effect that it does tend to make women feel more youthful, look more youthful. Because what estrogen does, it supports the collagen, the supporting structure under the skin, which gives the face volume, stops sagging, stops lines and wrinkles. It also has an effect to plump up the outer layers of the skin as well, in the same way that it's used for vaginal dryness and creates moisture.
Okay.
So the side effect is a good one. Obviously, it's not a facial cosmetic. It doesn't have a licence for that. But in studies that they've done comparing women on HRT to women who aren't on HRT, onlookers said that the women on HRT did look up to 8 years younger when they were on HRT.
That's so interesting. So that's why it's not really that I've got a fat face.
Not at all.
It's HRT. And on the note of HRT, we've actually got a question from our viewer, Sonia.
Hi doctors, I have a question regarding my hormone replacement patches. I've been told to cut them in half, but wondered if that would impact the effectiveness of them, as you see the pharmacist thinks it would.
Oh, that's interesting. What do we think?
Well, the matrix patches, the estrogen or the progesterone is in the adhesive that you stick to the skin.
Right.
So it's perfectly feasible to cut them in half from corner to corner, diagonally, and, of course, it will reduce the dose. So it's one way of reducing the dose. You can cut them in half, in a third, whatever the doctor says you should do.
Okay.
So it's perfectly possible to do that. The old-fashioned patches contained a bubble of liquid. You couldn't do it. But with the matrix patches, where the estrogen or the progesterone is in the adhesive, you can do that perfectly well.
Ah, that's so interesting, Amir. I didn't really know that. I suppose if you wanted to lower the dose, that's one way of doing it, but only to check with your doctor.
Only check with your doctor. And if you are going to do it, the best way to do it is diagonally across the patch. That way, corner to corner, that way you get a really accurate half patch rather than in the middle, which might not be as accurate.
Oh, that's interesting. See, I didn't know that.
Yeah. Now, I'm looking at Amir's face to see if he's well. He's obviously very well, but I'm going to send him some wool to get that jersey darned.
Oh, jeez, Amir!
Hilary,
I know it is.
Oh, my goodness. They've got big moths there.
Got huge
massive moths, and they've had a field day. No, it's fashion.
Mark will understand fashion.
Love it.
It's fashion,
Love
it's
it.
fashion.
Love it.
Now, look, Hilary, it is World Mental Health Day
Yes.
today, which is an opportunity for everybody to talk about their mental health, but also stress can have a huge effect on your face, can't it? You can get all, you can tell when someone's stressed.
So there's this TikTok meme going around now talking about cortisol face. Now, this is based on a bit of science that says that cortisol is the stress hormone. Now, anyone on high doses of steroids for chemotherapy, for cancer treatment, or for other conditions which are autoimmune, such as rheumatoid arthritis or lupus, they will develop a moon face, what we call a moon face, so sort of puffiness of the cheeks.
Oh, sure.
But people who are stressed won't get that. They might produce more cortisol, a natural stress hormone, but they won't get a moon face that's not strong enough to do that. However, when people are stressed, the opposite happens. People are stressed, they don't sleep very well, they tend to smoke too much, drink too much alcohol, and they look gaunt. So the opposite happens when people are stressed. They don't get cortisol face as described on TikTok or social media.
Fascinating. Now, it's cold season, of course. We've got a question from Julie. Julie says that she is very prone to picking up infections. Is there anything, Dr Amir, that she can do to get her immunity boosted, if you like?
Yeah, so she can definitely support a healthy immune system. Usually, if you're picking up lots of colds, it's your body's way of saying, take the foot off the pedal, you're going too much. So you could do some exercise, you can sleep better, hydrate more, but there's certain foods as well. So vitamin C is what you need, so you can get that from citrus fruit, broccoli, and nuts and seeds. You want some vitamin E, almonds, sunflower seeds, and spinach. Zinc is really good for supporting the immune system, beans and shellfish for that, and magnesium, nuts and seeds as well. And remember, wash your hands regularly, wipe down surfaces, particularly door handles, because colds and flus are spread by droplets. So kind of staying away from those people as well is my favourite way of keeping away from a cold. But all of those things will help.
Fantastic. Thank you so much. Thank you, Amir. Mama Khan's going to give him into trouble for that jumper. She's
Yeah,
going
I'm
to be
sending
pleased.
one in the post to him.
Thank you both very much, both of you.